So we just completed the shoulder joint mobilization, so now we're going to move distal along the upper extremity. So the first one is the humeral ulnar joint mobilization, and that is going to increase elbow flexion. So similar to the talocrural joint mobilizations, I'm going to interlace my fingers along the distal humerus into the radius and ulna, and I'm going to require a scooping motion with my pinkies to scoop the trochlea out of the trochlear notch. So I'm pulling just straight inferior with that scooping motion. You could do it in this position, or you can also have the patient seated in front of you in a chair and then just have them rest their arm on the table. Again, I'm just scooping straight inferior with that motion. You can go ahead and lay on your back. So next we have the radiohumeral glides. We have an anterior and a posterior glide. For these ones, again, I'm just going to have the patient relax their hand. I'm going to use my elbow to stabilize it against my hip. I'm going to grasp the radial head. So remember, the radial head is proximal. So that's going to be right here. If I'm doing an anterior glide, that just means I'm going from posterior to anterior. So I'm just going to pull the radial head forward. This will help with elbow flexion. My left hand is just stabilizing the humerus. If I were to do a posterior glide, I'm just going to push anterior to posterior on the radial head, and that would help with elbow extension. Is that okay? Feels weird?
No.
No? Okay, good. So we just did the radial humeral joint mobilizations, and now we're going to do the radial ulnar. So instead of grabbing on the radial side, I'm just going to grasp on the ulnar side. I'm going to do an anterior glide, so that's going to be moving from posterior to anterior, and I'm just going to shift the ulna in that posterior to anterior position to increase elbow supination. If I were to do a posterior glide, I'm just going to push down, so anterior to posterior, and that's going to increase elbow pronation.